Hello, this is David Bishai, and I'm here to present our segment on the role of government in health. This is part 2 to cover public goods and merit goods. Part of the reasons governments get involved in health is to solve problems in this area of public goods and merit goods. So let's define merit goods. Merit goods are underconsumed by individuals, yet judged to be desirable by someone else, often a government or your mother or your teacher decides that you should have more of this. The examples are education and vaccinations and exercise. The rationale might be that there's an externality like contagion or the need of the government to create an army. They need people to be healthy, and so they will say to the citizens, you should have more of these things like education or vaccinations. So the rationale is paternalistic altruism, the idea that person A wants person B to be happy. That's just altruism, and if you're altruistic like that, you just give person B cash and say to person B, spend it on whatever you want. Paternalistic altruism is when person A wants person B to be happy in the exact manner defined by person A. And so we don't give person B cash, we give person B a good, like the merit good, the food, or the vaccine, or medical assistance. So paternalistic altruism is, I want you to be happy in this prescribed way. Let's talk about a few more definitions while we're at it. We've got merit goods, a good that someone else wants you to have more of. A rival good is a good that can only be consumed by one person at a time, like a cookie. Only one person can eat the cookie, although many people can look at it. One person can eat a cookie, that makes it a rival good. There are non-rival goods where consumption by person A does not affect the consumption by person B. That might be the ability to look at the moon. Everybody can look at the moon tonight as long as it's night, and my looking at it doesn't interfere with your ability to look at it. There are excludable goods, goods for which it is possible to exclude people and keep them from enjoying it. People who didn't pay for the service or the good can be excluded if we enforce private property rights. Non-members can be excluded. Non-citizens can be excluded. So excludable goods have the ability to stop people from enjoying them. But there are non-excludable goods where it's not possible to stop people from enjoying them. And looking at the moon is one of those. It's not possible to fully stop people from looking at the moon. So we can combine these and say that a pure public good can finally be defined as a good that is non-rival and non-excludable, that everybody can enjoy it and you can't stop anybody from enjoying it. That makes something a public good. So here are some leading examples of public goods in health. Controlling a contagious disease like COVID-19 is definitely a public good. That if we make the COVID-19 infection rate go down, everybody who gets to enjoy that. And it's not possible to say to some person, you're not going to get to enjoy the control of this contagious disease. Controlling environmental health threats are similar, making the air cleaner, making the water cleaner, making the number of rats in the city go away, number of mosquitoes. These are things that are non-rival, non-excludable. Regulating dangerous consumer products. If something is of poor quality and dangerous, creating institutions that improve the safety of products is something that is a public good. And that same thread, safe roads are like that. If we make the roads safer for everybody, it's hard to exclude people from that. You could imagine a toll system, but it's not possible to put a toll on every single road. So for us in healthcare, the quality of the health services in a country is a very special form of a public good. If we create institutions that make medications safe, that make hospitals safe, that make healthcare providers safe, in general, because these institutions work in general, that is a public good. If we create safe pills for one person, That's not a public good. So if we create a general institution that improves healthcare quality, that's a public good. And if in general we protect all of the vulnerable people from health conditions in our economy, that's also a public good, a very special public good for us in health. So let's go back to a taxonomy so we don't forget how to find the public goods. The rival versus non-rival, excludable versus non-excludable. So up in the top left corner, we have private goods. They're rival and they're excludable. A cheeseburger is something that is in the space of private goods. A haircut. If I get a haircut, you can't have my haircut. A personal trainer trains me, and while they're personally training me, they can't train anybody else, and a personal trainer can exclude other people who didn't pay for their services. A club good is non-rival, but excludable. So if I build up a cable TV network and start beaming products over my cable TV network, everybody gets to watch HBO shows or CNN on the network, but the Comcast cable company can exclude non-payers and say you don't get access unless you pay me. And the same with an HMO. If I have a network of doctors and hospitals in my HMO, I can exclude people who don't pay for my club and keep them out. So I could make the HMO quality excludable, but everybody in the HMO non-rivalry will enjoy that good. There are non-excludable rival goods. A trout stream is the best example of a common pool resource where I take a trout out of the stream and you can't have it, but unless there's a way to put a fence all the way around the trout stream, then it's not excludable. And finally, we've already talked about this last example of non-rival, non-excludable, and that's the pure public good. So the thing that helps us solve these problems is to focus on excludability. And often the nation or the government has been the unit that creates an excludability clause. And we say, we have formed a government of our land, and everybody here will enjoy the public goods of our country. We will provide the most common public good provided as countries set up is national defense. We will put up an army for the public good, for the defense of the people in our country. Historically, that was super important because, 10,000 years ago, that was the big problem, that people would come in from the mountains and take all your stuff, and you needed an army to stop that. So from a global perspective, national defense is a club good. The countries are clubs. They've set up excludability clauses and says our citizens are paying for this army and we get the army. Are there goods that are public for the entire planet? And the answer is yeah, there are. And non-excludability applying to everybody on the whole planet, that would work for COVID-19 eradication. That would be a public good. Everybody on the planet would benefit from that achievement, and everybody on the planet couldn't be excluded. But there are many, many local public goods that a club could help us with. Clean water, an altruistic glow from a poor person getting health care, institutions that improve the quality of care, and lowering prevalence of contagious disease. When you download the PowerPoint version of these slides, just a note to take a look underneath the notes part of this slide, because I have some extra notes material about whether altruistic glow is a local or a global public good. So take a look at that if you have extra curiosity. I thought you might enjoy a few notes on local versus global altruistic glow. So in our next section, we'll be covering how to solve public goods problems, because they are in scarcity and short supply everywhere on Earth, and we do need to solve public goods problems in order to have a better life.